Good morning to you, to Gisela in the studio. Thanks for the introduction and all the technical team and the audience that tunes in every morning. We begin today's briefing stating that it's one more day without deaths in our country. This is an achievement that is being consolidating. Yesterday we saw the dialogue that our president and prime minister and vice ministers had with scientists that are involved in this task, whose results are undoubtedly part of the efforts by our health personnel taking care of the patients. Also to note, as part of this is the growing awareness among our people of the importance of going to the doctor timely, in a timely fashion, as early as possible, of the staff who performs the assessments and the use of different treatment modalities that have definitely led to current results. Today we're keeping in our hospitals 569 patients, 2 in surveillance, suspects 406, confirmed 161. In primary healthcare observation, 1,815 people. Yesterday, 1,363 samples were tested for SARS-CoV-2 virus and COVID-19. In the Pedro Correa Institute of Tropical Medicine Laboratory, 421 samples were processed. In the Epidemiology and Microbiology Laboratory in Havana, 282. In Santiago de Cuba Laboratory, 189. In the Almejiras Brothers Hospital Laboratory, 132. And in Villa Clara, 127. And in the Biotechnology and Genetic Engineering Center Laboratory, 212 samples were processed yesterday. As a result of the study of these samples, 22 tested positive for 1.6% of all samples processed yesterday. And Cuba has already studied 101,108 samples of people suspected or contacts or with certain symptoms related to SARS-CoV-2 virus. And of that study, 2,005 have tested positive of the disease, 2% of all the processed samples. Of the 22 cases confirmed yesterday, all are Cuban. Of these, 18 are contacts of confirmed cases, and thus 1,755 people out of the 2,005 positive ones have been diagnosed as contacts of confirmed cases for 89.4%. This definitely shows the importance of this risk group. Of the 22 cases, in 4 of them, it has not been possible to determine the source of infection, and we're looking for their origin. Up to now, 77 of the 2,005 cases, it has not been possible to detect the source of the infection, which is 3.9%. The figure of 132 people whose source of infection has been abroad remains unchanged. Of the 22 cases diagnosed, 13 are of the female sex, a number higher than those of the male sex. In the cumulative total, 991 people diagnosed with the disease are female, that is 49.4%. 9 out of the 22 were male yesterday, accumulating 1,014 male cases confirmed with COVID-19. That is 50.6%. 72.7%, that is 16 out of the 22 were asymptomatic at the time they were diagnosed with the disease. And this is the other group that we insist on its importance. And this is why we are conducting the population studies in places which has not reported no cases of the disease. In the cumulative total of the pandemic, 1,020 people, that is 50.20% of the diagnosed people, have been asymptomatic when testing positive. The age groups most affected of the 22 cases is that under 40 years of age, and the group of 40 to 60 years of age. In each one of them, there were 9 cases. That is 40.9% of the cases were in those age groups. Yesterday, there were 4 children diagnosed, one 9-year-old girl from Havana. All 4 children are positive cases contacts. One 7-year-old girl and one 10-year-old boy, both from Bauta in Artemisa province, and a 17-year-old boy from Havana. With these cases, we have accumulated 224 children diagnosed in our country with COVID-19, out of which 204 have been discharged. Yesterday, we also saw during the dialogue of the President with the scientists, one specialist who explained how the children's evolution has taken place, how they have had no complications despite of a number of confirmed cases that is not small in our country. In terms of cases per provinces, Havana reports 17 of the 22 cases, representing 77.3% of all the diagnosed cases yesterday. After the latest diagnosis, Cuba already accumulates 2,005 people who have been diagnosed with the disease, and 161 have remained in hospitals. These are the active cases that we have in the country as of 12 midnight last night. A favorable element is that out of those 161, 158, that is 98.1%, have a favorable clinical evolution. We always say it, we grieve the death of 82 people in our country, and that gives us a lethality rate of 4.08%. And as we have said in other occasions, Cuba remains in the 16th place among the countries of the region in terms of the lethality rate. The region's lethality currently stands at 5.8%, with the highest rate in Mexico with 11.02, Ecuador with 8.06, Canada with 7.3, Brazil with 6.22, and the United States with 5.91%. In the Caribbean region, the pandemic behavior is somewhat different, and let me correct the data that we gave yesterday with respect to St. Kitts and Nevis, which was reported with 2 deaths, when in fact this country has reported no deaths so far. We verified that data with information provided by the World Health Organization. We have the 2 evacuees that we always mention, and yesterday 26 patients were discharged, despite the number of cases that were confirmed today, which definitely displeases practically all Cubans, but nonetheless the number of discharges was higher than those of confirmed cases. And of all patients diagnosed, 1,760 people have recovered, and they are either back to their everyday activities or under observation, quarantined at their homes, and that is 87.4%. Today we have to report we have 3 patients in serious condition. No patients are in critical condition. These 3 patients in serious condition are admitted in the Salvador Allende Hospital here in Havana. And comparing with yesterday's report, today we have 2 additional patients in serious condition. Now turning to the situation in the world, the same 185 countries remain with cases of COVID-19. Yesterday, and this is significant data, over 100,907 cases were confirmed in one single day. And we ordered this number because we already are used to this type of figures. But this is really a very complicated situation, the one we are seeing around the world with this pandemic, which is totaling 5,656,615 confirmed cases, and yesterday 5,143 people died in the world, for a cumulative total of 355,355 deaths, for a lethality of 6.28%. The region of the Americas, for 2,630,856 confirmed cases, 58,882 yesterday alone. Notice that the region had more than 50% of the world's confirmed cases yesterday, and so we can realize the extent of this problem. The cases confirmed in the region already accounts for 46.5% of all cases in the world. And 3,575 people died in the region yesterday, totaling 152,508 fatalities, for a lethality of 5.8%, which is higher than the rate the region had yesterday. And with this, we conclude the information we had on Cuba and the world.